Right, good afternoon, everyone. Thank you for joining us for this fireside chat. I'm glad the fire isn't here. It's hot enough. So we'd like to frame this discussion about, the impact of NHI as a catalyst for change or development within property development in South Africa, how that could impact that. Now, as you know, the Act has been passed. Its exact form and implementation, I think, is still accepted by everybody, government and the private sector. Both, it's unclear exactly how it will implement it. But clearly there's a need. The challenge for government is to upgrade its facilities or expand its facilities to meet the expectations of the marginalized citizens of the country who doesn't have access to private healthcare. And clearly private healthcare in its current form is unattainable and unaffordable for the masses. So I think what we want to discuss is potentially where does that solution lie. So with me I've got Heinrich Rix of the Oryx Group of companies. So I'll let him very quickly introduce a little bit more of what they do, but I believe that he is and his companies are some of the champions of change that we're going to be seeing in the healthcare sector to try and bring these two these two poles of private and public healthcare closer together. So maybe I'll hand over to Heinrich.
Hello. Thank you, Alex. Good afternoon, everybody. It's a great privilege to be able to sit here and give some of our personal insights on this topic. So firstly, us at the Oryx Group, just for some background, we've been involved in the funding of private healthcare, but to the affordable market. In other words, people who had not previously had cover like medical aid. So we started back roughly in 2002, and we were able to build a really sustainable healthcare model that offers roughly 60% more affordable, the same benefits that people are accessing on other products today. So given that context, the question in our environment is always the affordability. And how do we achieve that affordability? Because the greatest challenge is creating access. So if we go back to roughly 2002, government published, or there was a report called the Vivian Taylor Report that actually outlines to a very large extent everything that we seeing transpiring in South Africa in regard to the National Health Insurance Act. And what that achieves or tries to achieve is to give everybody access to the same level of healthcare. So at the moment, if we look at how much is being spent on healthcare in South Africa, it's about 240 billion rand spent on private healthcare. That accounts only for 16% of the population. So that roughly is half of what's being spent in the public sector. The public sector spends roughly 260 billion rand per annum. So you can see there's a great inequality and a great discrepancy in terms of what we are spending in the private sector as opposed to what we're spending in the public sector. So how do we change this? And I actually would have liked to invite Bobby back to the stage, because what he says resonates so very well with us. In South Africa, we have an incredibly well-organized private healthcare sector, and we have a great quality of private healthcare that you'd battle to beat value for money anywhere in the world. So the problem is that in the public sector, that's not the truth. For many of us in South Africa sitting here, we were all born in public hospitals. But that scenario has changed for the average person. And I'm unsure whether the National Health Insurance Act will rectify that. Because I don't know if we have enough money to do that. And for us to be able to achieve that, it means that the roughly 14 million people that are currently employed formally in South Africa are going to have to be taxed more, or we're going to have to lower the level of healthcare that we give people access to. So the question then begs, is there still opportunity? But I'm quite sure we'll get to that.
Yeah, so I think what Heinrich touched on, so obviously we need to frame this very complex issue within the context of property development and what that might mean, never mind the development, what that might mean on the kind of physical resources that one needs to put in place to start to enable this. The Oryx Group does quite a lot of work in that space, especially in the environment of technology and innovation as well. So maybe if I ask the question to my colleague, yeah, and feel free if anybody's got a specific question that they want to ask. I think it's our fireside chat. We can chat any way we want to. So please put up your hand and we'll take a question as well. But so maybe if we look at the combination of property development, the use of technology and AI specifically, which you guys are working on, how do you see that impacting potentially the kind of environment, the built environment in the country, in healthcare?
So Alex, I don't want to rephrase your question, but maybe I want to extend the part that we were touching on. So the biggest problem in South Africa right now, if we look at what's happening in the steel industry, the steel industry is failing not because of that we don't have tariffs in place, not because there are so many other issues in terms of business agreements, in terms of tariffs imposed by America. The steel industry is failing because of lack of infrastructure. So if we talk about healthcare, most probably it's the same. So yes, there's infrastructure, but it's not being managed well. So how does that then provide an opportunity for infrastructure development in healthcare in South Africa if we're saying that the current infrastructure is failing? So the first thing is when we talk about this, people will say, but what about the water? And what about the roads, like Bobby referred to? And what about electricity? And all these challenges. But those challenges are the same for any business that exists in South Africa. And if we decide to remain in South Africa, and if we want to make South Africa a better place, the private sector will have to solve this problem. So industries like the steel industry, like the mining industry, especially the mining industry, have previously had healthcare infrastructure on site. And us as the private sector need to actually invest in infrastructure so that we can partner with government. And it's like Bobby said in the previous chat here, is that if we wait for government to do that, that's not going to happen. So what we're going to find is a further decay and slide in the provision of services. So one of the things that our company is doing, and that I think is being done all over the world, is firstly, what got us here in healthcare will not get us where we need to be. So we need to change the narrative. We need to not stop treating, but move the focus from treating and managing symptoms to keeping people healthy. So we should spend more money on keeping people healthy, and that starts at a primary care level. So if we take you to any of the government facilities right now, you'll see that people will sit and wait there for a whole day, for 8 to 10 hours, to be able to access a very basic thing like the chronic medication for the month. That's highly inefficient. So that can be changed completely, very quickly. But unless we change the management structure of that, and unless we change the way we go about doing that business, we're not going to achieve that. So if you're asking me how we can use AI, before we get to implementing the AI, we need facilities that are technology friendly. We need to be able to implement the flow of patients, better services, better diagnostics, so that we can empower healthcare workers and doctors to use the better information to make better decisions.
Yeah, and then obviously by doing that, you're going to reduce the burden on the physical facilities because your patient throughput is faster and more efficient, etc. But, you know, I'd like to move us a little bit along, is that I do believe that a new type of facility may well be required. So, you know, because of our past and the lack of infrastructure development over maybe 30, 40, 50 years, we found that, especially in the rural South Africa, there just simply isn't access to first contact centers, even clinics, and there where it is, it's inadequate. So maybe if we can look at, how do you see that space evolving potentially?
Okay, so if we agree that primary health care right now is by far the biggest need, it actually depends who we ask, but in general, primary health care is the starting point. So if you look at the facilities right now, there's a huge lack of proper facilities. Even in private healthcare, you know, the solutions for healthcare in South Africa are regional. Because healthcare in Cape Town looks completely different to what healthcare looks like in the Northern Cape. And if we don't acknowledge those differences, we can't solve for that. But certainly private healthcare or primary healthcare facilities where you could actually triage patients much easier, much quicker, by simply knowing what they need next, so that you can triage them. Not everybody needs to see the doctor. Some people can see the nurse, some people need to fill a script, some people need to collect chronic medication. And with technology now, it's quite easy to empower primary healthcare workers to triage those patients. So where patients would be sitting in a line waiting to see a single person, you could actually, with technology now, process all of those people as they come in, so that you know what the next step is. And by triaging those patients, you can actually move them through the facility much quicker. Our guesstimate is roughly that you could do 4 times as many of the patients in a single facility by just being more efficient and managing that in a much better space. The second most important thing is, because you freed up the time of the doctor, you can actually increase the scope of what a GP could do. Because GPs traditionally used to do quite a lot. So if you create the correct infrastructure, and if you deploy the right technology, and also diagnostics, then it's easier to be much more effective and to lower the cost of healthcare, which again makes it possible for government maybe to acquire some of those services from you.
Yeah, so the point you're making is, if you can drive down the cost, argument's sake, of a scan or of a doctor's appointment, etc., then it becomes attainable potentially for the NHS-funded, It's clearly I spent some time in the UK, and the NHI funded services to actually acquire services from the private sector at a reasonable cost, which would be more palatable. And doing so, you're automatically tapping into a private healthcare system that's already very well developed in the country. Unfortunately, not in its current form. I don't see that being possible.
Yes, so I think when you create these facilities and you can have a greater throughput, you actually need, to lower the cost of healthcare, you need critical mass, which means that you can accommodate the public patients. And by so doing, you will lower the cost of healthcare even in the current public sector. So the question is not whether we should be making provision for those people. I think the question is that private healthcare actually has an obligation. And I think in private healthcare, the motive for profit sometimes is exorbitant. So you refer to scans. I can do an MRI scan of my foot right now one of your colleagues is Spanish. So Louis, I could do this scan in Barcelona now for roughly 4,500 rand. That same scan in South Africa would cost me no less than 9,000 rand. So if a cappuccino and a meal and a bottle of wine and everything costs me so much more in Europe, how is it possible that we can not do a scan in South Africa cheaper than it's being done in Europe?
Oh, no, that's fascinating. Are there any comments from the floor? Does anybody want to offer? I don't know whether we've got a mic available, but I can run. Does anybody have any questions? Yes?
There you go. It's okay. Afternoon. My question speaks to how do we strike that balance between public health care, which is free in Europe and in other parts of the world, but those same jurisdictions complain about long waiting times. And in the private healthcare, how do we manage the profiteering?
Thank you. So firstly, I think the question that you're asking is actually very relevant, because the diseases that we acquire do not discriminate. So if you're a diabetic and I'm a diabetic, we're actually faced with the same challenges and we need the same level of health care. And you cannot get better outcomes by lowering the standards. So what we ought to be doing is ought to be increasing the standards in the public sector. But that's not going to happen, because if we just pour more money into the same system, we're going to be wasting more money, and that's something that we can't afford, because nobody's actually convinced me any otherwise. So I know that this isn't very popular if I say this, but if we as a private healthcare sector don't change and don't disrupt ourselves, then we're not going to solve anything. So if you ask me, if I look at the spend in the public sector, and we can make these massive savings by introducing technology and more efficiencies, are we really going to save that money? Are we going to cut the budget by 30%? I don't know. I think what we will be able to do is we will be able to stretch that money and give more people access to better diagnosis, but we'll spend the same amount of money. But maybe there's actually a cross-subsidy model. So if we say this basket of care is primary care, can a public or a private facility say, but for every 4 private patients I see, I can accommodate 1 other patient at a marginal cost? So you create a marginal cost model. But like I said, you need critical mass for that. And then you need to identify those areas geographically where you could be most effective in. But certainly, if we want to change the narrative in South Africa, that's what we need to do. But if you listen carefully to some of the people that spoke here today, you'll realize that that's not just a challenge for South Africa, it's a challenge everywhere. I'll give you one last example. I'm quite passionate about this. In South Africa, there are drugs that we utilize there that might cost, for a treatment course, might cost us, let's say, 800 rand. That same drug in the US, a whole treatment protocol for that would most probably cost you 84,000 rand. So if we look at that, then it really makes it difficult to understand why these big discrepancies exist. In our market, particularly, HIV is a massive issue, and it has always been. But it's under control, and what we've been able to do is negotiate with pharmaceutical companies to get that price even at lower than what government's currently paying for that. So if these inefficiencies exist and we remove them from the model, we'll get a lot closer. I don't have all the answers, but we'll get a lot closer to solving that problem. The last thing I wanted to say is, so when somebody's tax liable in South Africa, in the funding environment, they actually get a tax rebate if they're on medical aid. The problem is, so for the person that's not tax liable, there's no subsidy in any event for him because he's not paying tax. But he also doesn't have an income. So we don't make provision there. So unless there's certain concessions, even at an employer level, and even, so if you, here's a question maybe, if I have a domestic servant in my house, or the domestic engineers, we call them in Pretoria, so I'm actually an employer. So I'm having an expense to be able to generate an income. So why isn't that a tax deduction for me? So if I could then pay for her to get some form of funding, some form of access to care, why can't I deduct that from my tax bill? Because that's a way of looking after people. And then the other point I just want to make, sometimes we need to create more benefits for an individual because those benefits can spill over to families. So if we create different funding or different funding mechanisms, if one person is employed, how do I ensure that the benefits that attached to that one person can be shared among the family? We'll have to be much more innovative in how we structure these products so that we can extend the range of cover.
Okay, thank you. I think our time is pretty much up. I'd just like to finally state that from a property investment point of view, there needs to be we need to be agile, and there needs to be foresight and investment from the private sector. We need to drag down the cost of the services. So every decision we make in that sphere needs to be focused on trying to reduce the cost of that service, trying to get closer to the point where the NHI, where it will be attainable for the public sector to actually partner with the private sector in delivering the service. And I think in doing so, with the use of technology and champions like the Oryx Group, we could get there. Thank you.
Thank you very much.
Thank you, gentlemen.